Hello friends, welcome back to Complete Medical Coding. In this episode, we will discuss mainly about the CPT codes, the basics of CPT codes. So, currently we are using the 4th edition of CPT code. Each procedure or service has a 5-digit codes. We need to select the exact procedure that accurately mention the service performed. We should not select a CPT code that merely approximates the service. The service performed that we are mentioning should be accurate. If no such accurate code exists, then we can report that code using an unlisted procedure. Now there are 3 categories of CPT: Category 1, Category 2, and Category 3. Category 1 codes are released once in a year, and it is in numeric order. Main body is listed in 6 sections. Each section is divided into subsections. So these are the subsections. These are the main 6 sections. E&M, Evaluation and Management Codes, and the range is from 99201 to 99499. Anesthesia codes ranges from 00100 to 01999, and 99100 to 99140. These are the add-on codes that comes under anesthesia. These codes will not be reported separately. Will not be reported as a primary code. Next is the surgery. Surgery code is 100212 to 69990. That's the range. Radiology codes ranges from 7 codes is the starting radiology codes. So that ranges from 70010 to 7999. Pathology and laboratory. The codes that start with 8. Codes that starts with 8 is the pathology, the lab codes. The range is from 80047 to 89398. Then medicine. Codes for the medicine ranges from 90281 to 99199 and 99500 to 99607. There will be few codes that are deleted codes. Each and every year it keeps on changing. So there might be some deleted codes in between. Every year you may be getting some updated versions of CPT codes. So these are category 1 codes and they are released once in a year. It's in a numeric order. There is no alphabets. It will be in the numeric orders. Now category 2 codes. Category 2 codes are released 3 times in a year with an effective date of 3 months after the release. After the first release, the next release will be 3 months. Like 3 times in a year, and the effective date will be 3 months from the release date. So these are the category 2 codes, and category 3 codes are released twice in a year with an effective date of 6 months after the release. Now add-on codes. What are add-on codes? Some of the listed procedures are carried out in addition to the primary procedure performed. So if a procedure is performed that cannot be listed as a primary procedure, that will be considered as an add-on codes. Add-on codes are represented by a plus symbol. But while coding, we will not use that plus symbol. We will mark it as a secondary code. It will not be a primary code. In the CPT book, code book, you'll be seeing a number of symbols just before the codes. So in that, plus symbol represents the add-on codes. These codes applies only to add-on procedures performed by the same physician. It should be the services performed should be by the same physician. And these codes are always performed in addition to the primary procedure and never be the primary code. For example, additional digits, lesions, vertebral segments, tendons, joints, etc. More detail I'll be discussing in the further upcoming chapters. Now, modifiers. Modifiers are always represented by two characters that are used to indicate that a service has both a professional and a technical component. Service performed by more than one physician or more than one location. If a service is performed by two physicians, we can represent it, we can mark it by using a modifier. There are different modifiers for each and every services. Like professional component, it's a separate modifier, technical separate modifier. If it is a bilateral code, it will be a separate modifier, etc. etc. And if it is more than one location also, we will be marking it as a modifier. It will be identified, it will be marked by modifier. Then service that was increased or reduced. Only part of a service was performed. An adjunctive service means a repeat service. The service is repeated. A bilateral procedure was performed. Service performed more than once. If the same service is performed twice, then we will be considering, we will be marking it as a, we will mark it by a modifier. Then if any unusual events occurred. All these are examples for modifiers, not examples. These are the cases where we use the modifiers. Now, these are some examples how we use a modifier. Don't use add-on code along with a modifier. We will never use modifier along with the add-on code. Modifiers will always be used in the primary procedure, primary code. First example, a physician providing diagnostic radiology services in a hospital. Add modifier 26 to report the professional component. For example, code, if you can see the CPT textbook, just go through the code 73090 with modifier 26. It represents a professional component only for an X-ray of the forearm. So it means if a physician is providing diagnostic radiology service, that physician is ordering for the X-ray of a forearm. So we will be marking it as a professional component 26. If it is a technical component like TC is the modifier that is used for a technical component. It will be performed by some like in a radiologist or in a diagnostic center. Then we will be marking it as a technical component, TC. Another example, two surgeons managing a specific surgical problem. Each surgeon should report his work by modifier 62. There are two different surgeons. So we need to report that two surgeons. So two surgeons will be represented reporting by modifier 62. For example, a neurological surgeon and an otolaryngologist performing transsphenoidal excision of a pituitary neoplasm. So there are two surgeons in this case, a neurological surgeon as well as an otolaryngologist. So the first surgeon performing transsphenoidal excision of a pituitary neoplasm. So 6154, it is the code for that procedure. So we will be reporting both the surgeons with the modifier 62. Both surgeons. First surgeon will be represented, will be reported with the same code and modifier 62, and the second surgeon will be reported with the same code and modifier 62. This is how we use some modifiers. Now, place of service and facility reporting. Evaluation and management codes are specific to a setting, like it can be office setting, hospital, clinic, whatever it is. So that is a place of service. Then services performed in the home by a physician. Two numeric characters. This place of service and facility reporting is reported by two numeric characters. Unlisted procedure or service. Some procedures are not found in CPT code set. It will be listed as unlisted procedure. If an unlisted procedure is used, the service or procedure should be described. If you are using that unlisted procedure, then whatever the service that we are performing, it should be described. Results, testing, interpretation, and report. Results are the technical component of a service. Testing leads to results, and results leads to interpretation. And reports are the work product of interpretation of test results. These are the code symbols which I have mentioned earlier. If you can go through the CPT code book, you will see a number of symbols like this. So these are the examples. Triangle represents a revised code. Dot represents a new code. All these symbols you will be finding just before the CPT. New or revised text. Add-on code, exceptions to modifier 51. Product pending FDA approval, that is mainly using for vaccinations. Telemedicine, audio, duplicate PLA, all these are examples. We are using mostly add-on codes. So that's all for today. And we will be moving on with the anesthesia chapter on the next episode. So friends, if you have any queries, you can please mention it in the comment box. So thank you so much. Please subscribe my video. Please subscribe my channel. Thank you. Bye.